Good afternoon, ma.
Good afternoon, sir.
I would like to know more about your work in your health center and in your immediate community. Can you tell us more about that?
I am Mrs. Mfon Chief Nursing Superintendent working with Health Center Idung Eniang, Eket local government area, Akwa, Ibom State, Nigeria. My health center covers 5 settlements.
Okay.
I can mention them for you. Ofrio, Afianse, Odronen, Afaradronen, and Ikorodoma.
Okay. I would like to know, have you heard of Awandek, an NGO in the state, and have they carried out any form of activity in your health center or community?
Yes, I have heard, I have tested, and I've gotten training from Awandek, the Women Health Action and Research Center, the United Nations Population Fund. They have trained me and my staff. They trained me on COVID-19, the sexual reproductive health, and gender-based violence. They have trained me on that, and I have been able to step down this training to my staff in the facility. And also, I have extended the training to the women,
Okay.
that come in for antenatal, that bring their children for immunization. I have been able to step down the training to the youths in these communities, the 5 communities.
Okay.
The churches. The sensitization has gone to cover the churches, the women group, and the youths in the 5 settlements.
Okay, ma. Apart from the trainings that you've gotten, I would like to know, have you gotten any form of materials, like in terms of tools or equipment from this organization, Awandek?
This is Awandek and Women Research Center and United Nations Population Fund has really supported us. For some years now, we ran short of so many things in our facilities. They have now supplied us with the PPEs. Example, in fact, the gloves, we had been going out to buy the gloves, but they have given us more than enough gloves, the face mask, goggles, and hand wash, hypo sanitizers. And they've given us phone to make calls.
Wow, that's amazing.
At our facilities. Each facility, at least we can communicate because this is digital era.
Okay. Apart from these trainings given to your facilities, are there any form of training that have not just impacted on your facility, but those coming to make use of the facilities, like the patients? Have you people gotten any form of training that can reach out to the patients?
Yes. In as much as they have trained us, we impact it into the sensitize the patients, the mothers that come in, we sensitize all of them, we impact it to them, and let them be aware that COVID-19 is really going on, is spreading. And we have taught them, like the hand washing, and they have to wash their hand, go through the triage station before they come in, and any possible case we suspect that is a COVID-19 case, we segregate them, keep aside, and refer to the appropriate institution.
Okay, ma. I would like to, as a final note, what can you say about the organization that have been able to make all these trainings and given you all this equipment to your health center and to your host community?
I really appreciate their efforts. I say kudos to them. They have done so much. The Awandek, the Women Health Research Center, the United Nations Population Fund, they have done so much. I thank them. I appreciate them for coming to help us in times like this, to give us the PPE equipment. But for them, I don't know what would have happened. So I say kudos to them, and God bless them real good for us.
Okay. Thank you, ma, for your time.
Thank you so much.
Thank you.